Welcome to OET Answers.
Your preparation time is over. Now, you can start your speaking role play. Don't worry if I stop you when the time is up.
Good morning, Mr. Smith. I'm Florence Nightingale, one of the nurses here in the ophthalmology ward. I see you're here to discuss your upcoming radiation therapy. How are you feeling about starting the treatment?
I'm a bit nervous, to be honest. I don't know what to expect, and I have a lot of questions.
That's completely understandable, Mr. Smith. Starting any new treatment can feel overwhelming. Why don't we take some time to go through everything, and I'll try to answer all your questions. Does that sound all right to you?
Yes, that would help. I know a little bit about eye melanoma, but I'm not really sure about the radiation therapy.
I'm glad you brought that up. Eye melanoma is a type of cancer that affects the cells in your eye, and radiation therapy is one of the key treatments we use to target and shrink the tumor. It's a non-invasive procedure, and the goal is to damage the cancer cells while minimizing harm to healthy tissue. Does that sound clear so far?
Yes, but I don't really know much about how the therapy works or how long it takes.
Let me explain. The radiation therapy is typically done in an outpatient setting, so you won't have to stay in the hospital. Most patients have 1 or 2 sessions per day for a period of 1 to 2 weeks. Each session lasts about 10 to 15 minutes, so it's not very time-consuming. Breaking the treatment into smaller sessions allows us to reduce side effects and protect your healthy tissues. How does that sound to you?
That sounds fine. But why so many sessions? Wouldn't it be better to just do one long session?
I understand why you might think that. Radiation is most effective when delivered in smaller doses over time, as this helps to target the tumor more precisely while giving your healthy cells time to recover. Larger doses all at once could increase the risk of side effects and damage to nearby healthy tissues. Does that answer your concern?
Yes, that makes sense. But I'm still not sure what the procedure will be like. Will it hurt?
That's a very common concern. The actual procedure is painless. During the session, the radiation will be precisely aimed at the tumor in your eye, and we take precautions to protect your healthy eye as well. You may be given a local anesthetic to keep you comfortable, but you won't feel the radiation itself. The treatment lasts about 10 to 15 minutes, and you'll be fully awake the whole time. If you feel anxious, you can try listening to calming music or practicing breathing exercises during the session. Does that sound like something that could help you relax?
I think the breathing exercises might help. The short duration of the sessions makes me feel a bit more comfortable too.
I'm glad to hear that. We want to make sure you're as comfortable as possible during the treatment. Now, let's talk about potential side effects. You might experience some temporary side effects like eye redness, blurred vision, dry eyes, or sensitivity to light. These side effects usually go away after treatment and can be managed with medications or eye drops. How do you feel about that?
The blurred vision worries me a little. Will it go away?
In most cases, yes. Blurred vision is often temporary and should improve once the treatment is completed. The extent of side effects can vary depending on factors like the size and location of the tumor and your overall health, but we'll be monitoring you closely and addressing any issues that come up. Does that help ease your concern?
Yes, that helps. What about after the treatment? Do I need to come back for checkups?
Yes, follow-up appointments are very important. After your radiation therapy, we'll schedule regular checkups to monitor your recovery and ensure the treatment is working as expected. These visits help us catch any potential complications early and make sure your eye is healing properly.
Should I arrange for someone to drive me to the treatments? Will I feel okay afterward?
That's a good question. Many patients feel fine after each session, but some might experience mild fatigue. I would recommend arranging for someone to drive you, especially for the first few sessions, until you know how your body responds. After that, you can adjust your plans depending on how you feel.
I'll ask a family member to help out for the first few days then.
That's a good plan. It's always best to have some support when you're starting something new like this. Before you go, I'll give you some informational leaflets that explain how to prepare for the sessions, what to bring with you, and some tips on staying comfortable during the treatment. Would you like to take those with you?
Yes, that would be helpful. Thank you.
You're welcome. The leaflets cover everything we've discussed today, but if any more questions come up, feel free to call us.
That is the end of your speaking role play. All the best.
Thank you.
Thank you for watching. Please like and subscribe for more videos like this. Kindly comment your suggestions and help us to do better.